Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. If you are preparing for GPAT Niper Drug Inspector Government Pharmacist, then this video is going to be very important, knowledge oriented and useful for your preparation. So it's my request to you, please watch this video until end. Students, in this video we are going to see classification number 3, and that is nothing but the classification of your adrenergic drugs from pharmacology, or classification of Sympatho mimetic drugs. So it's my request to you again, please watch this video until end because it is very important video for you. You might have seen the nervous system in the first year B.Pharm from the anatomy physiology. So your nervous system is divided into two parts. First one is known as the CNS or central nervous system, or which is comprising of brain and spinal cord. Now another system is there known as a peripheral nervous system, known as a PNS, and it is divided into two parts. It is consisting in nerve fibers. So PNS will have autonomic nerve fibers and somatic nerve fibers. So what do you mean by autonomic nerves? So autonomic nerve means, so these are the nerve fiber or the nerve which are supplied to a specific organ. So that organs you cannot control that organ. So it is not under your voluntary control. Autonomic nerves means not under voluntary control. For example, heartbeats, you cannot control your heartbeat. आप भले ही किसी को बोलो कि जानू मेरा दिल बस तेरे लिए धड़कता है, आप कितना भी बोलो कि मेरा दिल जानू तेरे लिए धड़कता है, लेकिन वो जानू आपका हार्ट बीट कंट्रोल नहीं कर सकती. So your heart, your kidney smooth muscle from kidney smooth muscles of GIT has some autonomy over there, and they are known as autonomic nerves. Okay, and second part is nothing but the somatic nerves. Somatic nerves means they are under voluntary control. For example, you can contract and relax your skeletal muscles like muscles of leg, hands, etc. So skeletal muscles, they are under voluntary control, known as somatic. Other muscles, smooth muscles of your myocardium, smooth muscles of your GIT, smooth muscles of your kidney or urinary bladder. So those smooth muscles which are not under your voluntary control and they have some sort of autonomy, and they comes under the autonomic fibers. Now this autonomic fibers or autonomic nervous system, it is divided into two parts depending upon the either anatomically or physiologically or pharmacologically. Depending upon the anatomy, physiology or pharmacology, they are divided into two types. Anatomically, they are divided into two types: craniosacral outflow and thoracolumbar outflow. Craniosacral outflow and thoracolumbar outflow. Okay, so thoracolumbar outflow is nothing but the parasympathetic nervous system, and this craniosacral outflow is nothing but the sympathetic nervous system. Okay, physiologically, autonomic nervous system, physiologically they are divided into two types: sympathetic nervous system and parasympathetic nervous system. Pharmacologically, your autonomic nervous system is divided into two types, that is adrenergic nervous system or sympathetic nervous system or sympathomimetic system, and cholinergic system or cholinomimetic system or parasympathomimetic system. So in the case of adrenergic or sympathetic nervous system, the neurotransmitter will be noradrenaline. In case of parasympathetic nervous system or cholinergic nervous system, your neurotransmitter will be acetylcholine. Okay, that is the difference. Now what do you mean by neurotransmitter? So they are nothing but the local hormones, or they are also known as the neurotransmitters, or they are also known as the neurohormones. So they are neurotransmitters. So neuro means in the neuron and transmitter means to transmit the signal. So they have function to transmit the information, okay, from one synaptic end to another neuron, one neuron to another neuron. So information is transmitted by this neurotransmitter. Now there are different kind of neurotransmitters, so they are also classified. उनका भी classes होता है. They are classified into different type. So neurotransmitters are classified according to the functions. कि उसका फंक्शन क्या है, कि वो एक्साइट करता है या इनहिबिट करता है या फिर मिक्स है. So depending on that, so depending on the functions, they are classified into either excitatory. Excitatory means those which will increase the stimulation. For example, excitatory neurotransmitter like acetylcholine, noradrenaline, 5-hydroxytryptamine. It is also known as serotonin. Then glutamic acid. You have to remember, याद रखो यहाँ पे excitatory neurotransmitter कौन से है? एसिटाइलकोलिन होता है, आपका नॉरएड्रेनालिन होता है, सेरोटोनिन होता है, सेरोटोनिन को ही क्या बोलते हैं अपन, 5 हाइड्रोक्सीट्रिप्टामाइन, और उसके बाद में ग्लूटामिक एसिड होता है। तो ऑल दीज आर द एक्साइटेटेड। इनहिबिटरी कौन से हैं, gamma aminobutyric acid, उसको अपन गाबा बोलते हैं, गाबा, gamma aminobutyric acid is inhibitory, then glycine is inhibitory, then alanine is inhibitory. So depending on function they are classified as either excitatory or inhibitory or both excitatory as well as inhibitory. So जैसे ये एसिटिलकोलिन के excitatory भी होता है, inhibitory भी होता है, लेकिन मैक्सिमम एक्साइटेटरी प्रेडोमिनेंट होता है, ठीक है। नाउ डिपेंडिंग ऑन द लोकेशन न्यूरोट्रांसमीटर आर क्लासिफाइड इनटू सेंट्रल न्यूरोट्रांसमीटर्स एंड पेरिफेरल न्यूरोट्रांसमीटर। तो सेंट्रल न्यूरोट्रांसमीटर मतलब क्या, सेंट्रल न्यूरोट्रांसमीटर मींस दोस व्हिच आर प्रेजेंट इन द सीएनएस, फॉर एग्जांपल एसिटिलकोलिन, डोपामाइन, सेरोटोनिन, हिस्टामाइन। सो दीज आर नोन एज सेंट्रल न्यूरोट्रांसमीटर, दे आर प्रेजेंट इन द सेंट्रल नर्वस सिस्टम ऊपर होते हैं। देन पेरिफेरल न्यूरोट्रांसमीटर, पेरिफेरी में कौन से थे, so peripheral neurotransmitter example acetylcholine and noradrenaline, they are known as a peripheral neurotransmitter. Now depending upon the chemistry of these, they are classified into different type, whether they are whether they are amines in the nature, whether they are amino acid in the nature, whether they are a peptide, whether they are a peptide or whether they are something else. So depending on that, depending upon the chemistry, they are classified into so amines or amino acids. So remember acetylcholine, noradrenaline, then dopamine, then bioadrenergic. These first four neurotransmitters are there. So first four, acetylcholine, noradrenaline, dopamine and bioadrenergic. They are known as amines. They are known as amines or biogenic amines. They are known as biogenic amines or monoamines. They are also known as monoamines or biogenic amines or amines neurotransmitter. Remember, इसके ऊपर क्वेश्चन आ चुके हैं, you have to remember it. Okay, then next one is a GABA, gamma aminobutyric acid, aspartic acid and glutamic acid. जो लास्ट के तीन है, GABA, aspartic acid, glutamic acid, all these are known as amino acids. Okay, they are amino acid neurotransmitter. तो अमाइन न्यूरोट्रांसमीटर कौन सा है, एसिटिलकोलिन, नॉरएड्रेनालिन, डोपामाइन, सेरोटोनिन। अमाइनो एसिड न्यूरोट्रांसमीटर कौन सा है, गाबा, एस्पार्टिक एसिड, ग्लूटामिक एसिड। नाउ अगेन पेप्टाइड न्यूरोट्रांसमीटर, सो एनकेफेलिन, एंडोर्फिन, डायनोर्फिन, सब्सटेंस पी, वैसोएक्टिव इंटेस्टिनल पेप्टाइड्स, सो दे आर नोन एज पेप्टाइड न्यूरोट्रांसमीटर। सो इसके ऊपर क्वेश्चन आता है, यू हैव टू रिमेंबर दिस। ओके, न्यूरोट्रांसमीटर डिपेंडिंग अपॉन द chemistry, depending upon the functions, depending upon the locations. Now we'll see the next part, that is as I told you, the neurotransmitter for sympathetic nervous system or adrenergic nervous system is nothing but the noradrenaline. So how there is a synthesis, that is a biosynthesis of noradrenaline, how there is a release, how there is a metabolism of this noradrenaline. So we'll try to understand in a short period. Noradrenaline, adrenaline, both are the biogenic amines. Dopamine is also biogenic amines, and these are the neurotransmitters. So they are commonly biosynthesized from one amino acid known as a phenylalanine or tyrosine. So you can say what is the bioprecursor for noradrenaline. तो क्वेश्चन में आ सकता है आपको कि एड्रेनालिन, नॉरएड्रेनालिन, डोपामाइन का बायोप्रिकर्सर कौन है। तो दोनों भी बायोप्रिकर्सर है, फिनाइलएलानिन भी है और टायरोसिन भी है। अगर टायरोसिन अवेलेबल नहीं है तो फिर फिनाइलएलानिन से बायोसिंथेसिस होता है। If tyrosine is available, then tyrosine is directly utilized. Synthesis or biosynthesis of your noradrenaline. How there is synthesis? So first of all, phenylalanine, that is the aromatic amino acid which is there in your body. Okay, so you get in from the diet. So that phenylalanine in the liver is converted into tyrosine. So phenylalanine hydroxylase नाम का जो एंजाइम है, phenylalanine hydroxylase will convert phenylalanine into tyrosine. Okay, you will get a tyrosine. Now tyrosine will be converted into dopa. Tyrosine will be converted into dopa, dihydroxyphenylalanine. Tyrosine will be converted into dopa by the enzyme tyrosine hydroxylase. Tyrosine hydroxylase will cause hydroxylation. So देखो, पहले phenylalanine था, उसका हाइड्रोक्सिलेशन हो गया, मतलब पैरा पोजीशन के ऊपर उसको हाइड्रोक्सिल ग्रुप आ गया, बन गया टायरोसिन। टायरोसिन का फिर से हाइड्रोक्सिलेशन होता है बाय टायरोसिन हाइड्रोक्सिलेज, तो बनता है डोपा डाइहाइड्रोक्सी फिनाइलएलानाइन। नाउ डोपा डीकार्बोक्सिलेज कन्वर्ट डोपा इनटू डोपामाइन। तो डोपा डीकार्बोक्सिलेज एंजाइम क्या करेगा, डीकार्बोक्सिलेज मतलब क्या, डीकार्बोक्सिलेज मतलब रिमूवल ऑफ कार्बोक्सिल ग्रुप, ये COH ग्रुप रिमूव कर देगा। सो डोपा डीकार्बोक्सिलेज विल कन्वर्ट डोपा इनटू डोपामाइन, you will get a dopamine. Now dopamine will be stored in the granules, dopamine containing granules of dopamine synthesis होगा, स्टोर किया जाएगा, इतना लगता है उतना, बाद में का बाकी जो है उसका कन्वर्जन होगा. So required amount of dopamine is stored in the granules and remaining amount will be converted into noradrenaline. So dopamine will be converted into noradrenaline by dopa hydroxylase, dopa beta hydroxylase, dopamine beta hydroxylase. तो डोपामाइन बीटा हाइड्रोक्सिलेज नाम का एंजाइम है, वो क्या करेगा, बीटा कार्बन एटम. तो बीटा कौन सा कार्बन एटम पता है, ये हो गया अल्फा कार्बन एटम, ये हो गया बीटा कार्बन एटम. सो ये जो बीटा कार्बन एटम है उसके ऊपर हाइड्रोक्सिल ग्रुप डाल देगा ये. सो दैट्स व्हाई नोन एज अ डोपामाइन बीटा हाइड्रोक्सिलेज. सो डोपामाइन बीटा हाइड्रोक्सिलेज विल कॉज हाइड्रोक्सिलेशन ऑफ दिस dopamine and will become noradrenaline. So this is noradrenaline. Now noradrenaline will be stored in the granules, neuronal cells. N-methyl transferase, that is noradrenaline N-methyl transferase will convert noradrenaline into adrenaline. N-methyl transferase मतलब क्या, यहाँ पे N क्या है, नाइट्रोजन के ऊपर मिथाइल डाल देगा ये. N-methyl transferase, it will convert noradrenaline into adrenaline. So देखो फिनाइल अलानिन होता है, फिनाइल अलानिन का हाइड्रोक्सिलेशन होता है, फिनाइल अलानिन का हाइड्रोक्सिलेशन होता है, बनता है टायरोसिन. टायरोसिन का हाइड्रोक्सिलेशन होता है, बनता है डोपा, दैट इज अ डाई हाइड्रोक्सी फिनाइल अलानिन. उसका क्या होता है, डी कार्बोक्सिलेशन होता है डोपा का, तो बनता है डोपामाइन. डोपामाइन का बाद में बीटा हाइड्रोक्सिलेशन होता है, ठीक है, बीटा हाइड्रोक्सिलेशन, उसके बाद में बनता है नॉरएड्रेनालिन, और फाइनली एन मिथाइल ट्रांसफर होता है, उसको मिथाइल ग्रुप ट्रांसफर होता है नाइट्रोजन के ऊपर एंड बनता है एड्रेनालिन. सो दैट्स हाउ देयर इज सिंथेसिस ऑफ योर बायोजेनिक अमाइंस और कैटेकोलामाइंस और these neurotransmitters. Okay, now we'll see the metabolism. After the synthesis they are stored in the synaptic vesicle. Okay, and when there is signal they will be released by the process of exocytosis. In the last session also I have explained this. ओके, सो जब रिलीज होना का होता है उसको, तो सिग्नल जब आता है तो कैल्शियम का इनवर्ड मूवमेंट चालू होता है. So calcium will be moved inside the synaptic vesicle and that will cause the exocytosis of your neurotransmitter. Okay, so remember neurotransmitter are released by exocytosis process. Now whatever adrenaline or adrenaline is there, so they are metabolized by different enzymes. So there are two principal enzymes that metabolize the catecholamines. So which are those? First one is known as a monoamine oxidase, MAO, monoamino oxidase enzyme, monoamino oxidase MAO, and दूसरा एक होता है, second one is a COMT, COMT. Okay, catecholamine orthomethyl transferase, catecholamine orthomethyl transferase. Okay, so principally this MAO B जो होता है, MAO के टाइप होते हैं, MAO A and MAO B. There are two types. So MAO B metabolize करता है डोपामाइन को. So MAO B metabolizes the dopamine in the brain and MAO A metabolizes the dopamine in the plasma. Okay, COMT जो होता है, catecholamine orthomethyl transferase, so they metabolizes the noradrenaline and adrenaline. So COMT metabolizes the adrenaline noradrenaline in a more amount, but very few amount of adrenaline also metabolized by MAO. MAO is the main metabolizing enzyme for dopamine. That's why MAO inhibitors are useful in the depression. Okay, so that's how these two enzymes they metabolizes the neurotransmitter. Now for example, noradrenaline will be metabolized by COMT, catecholamine orthomethyl transferase. तो यहाँ पे देखो ऑर्थो पोजीशन के जो ऊपर जो हाइड्रोजन ग्रुप है वो आप मिथाइल ट्रांसफर होगा, सो इट विल बिकम अ नॉरमेटानेफ्रिन. So noradrenaline will be converted to normetanephrine by COMT. Your adrenaline will be converted into metanephrine by COMT. So adrenaline to metanephrine, noradrenaline to normetanephrine. Now MAO जो होता है, MAO will also convert small amount of adrenaline into this 3,4-dioxy mandelic acid. Again noradrenaline also converted into small amount 3,4-dioxy mandelic acid. That 3,4-dioxy mandelic acid is converted into 3-methoxy-4-hydroxy mandelic acid, or it is known as a vanille mandelic acid, VMA, vanille mandelic acid by COMT. There was a question, okay, once they asked the principal metabolite of catecholamine, that is nothing but the vanille mandelic acid. Now these metabolites, metanephrine, normetanephrine, vanille mandelic acid, so they are removed from the body by glucuronide or sulfate conjugation. That's how there is a metabolism of catecholamine. Now we'll see the next adrenergic drugs, or they are also known as sympathomimetic drugs. So adrenergic or sympathomimetic drugs, now they are classified depending upon their use. So उनका use क्या है, हर एक drug का use क्या है, so उसके against उसके accordingly उनका classify किया गया. So depending upon their uses they are classified. So they are classified into different classes. So adrenergic drugs they are classified as a, or sympathomimetic drugs they are classified into 7 classes. So first class will be those drugs which are used as a pressure agent. Pressure agent means those drugs which are used to increase the blood pressure. Pressure means they will cause constriction of blood vessel. So pressure agent which are used to increase the blood pressure. So in that you have noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine and mephenteramine. So noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine and mephenteramine. You have to remember this, okay? Mostly natural. So noradrenaline is a neurotransmitter as it is, okay? Then ephedrine is an alkaloid from Ephedra geridiana, Ephedraceae or Gentiaceae. Then dopamine is also neurotransmitter. Phenylephrine is nothing but the semisynthetic. Methoxamine is semisynthetic. Mephenteramine is a semisynthetic. So remember these drugs which are used to increase the blood pressure known as a pressure agent. Second class of your adrenergic drug, that is a cardiac stimulant. Now these drugs they are used to stimulate the heart muscle. So what is adrenaline, isoprenaline and dopamine? Adrenaline, isoprenaline and dopamine. So they are used as a cardiac stimulant in case of cardiac arrest. अगर आपका हार्ट आपके हार्ट में अरेस्ट हो गया, कार्डियक अरेस्ट हो गया, सो इन दैट केस एड्रेनालिन इज अ ड्रग ऑफ चॉइस. या फिर अभी आजकल नया नया आइसोप्रेनालिन इज अ ड्रग ऑफ चॉइस बिकॉज इट इज अ सिलेक्टिव इन एक्शन, कार्डियो सिलेक्टिव एक्शन होता है इसका आइसोप्रेनालिन. ओके, सो दैट्स व्हाई ड्रग ऑफ चॉइस इन अ कार्डियोजेनिक शॉक isoprenaline, remember. Okay, so adrenaline, isoprenaline and dopamine they are known as a cardiac stimulant. Now third class is nothing but the bronchodilators. So those which will dilate your bronchial smooth muscle and they are used in the asthma. Therefore they are used in the treatment of asthma. So in that you have isoprenaline, salbutamol which is also known as albuterol, then terbutaline, salmeterol, then formoterol and then bombuterol. Okay, so remember isoprenaline, salbutamol is also known as albuterol, terbutaline, salmeterol, formoterol, then bombuterol. So जो terols है सब कुछ terols, जो terols है salmeterol, formoterol, then bombuterol. So all these are albuterol. So all these are drugs used in the treatment of asthma. Okay. Fourth class is nothing but the nasal decongestant. Nasal decongestant. These drugs are used in the treatment of rhinitis or sneezing or congestion, nasal congestion. So in that you have xylomethazoline, oxymethazoline, nepazoline, phenylephrine, phenylpropylamine and pseudoephedrine. So zoline जो होते हैं मेटाजोलिन, जोलिन जो है xylomethazoline, oxymethazoline, nepazoline, तो ये तो obviously they are known as a alpha agonist. So they are used as a nasal decongestant. तो इसमें आप याद रखो ट्रिक वगैरह बना के. So phenylephrine, then phenylpropylamine and pseudoephedrine. Those adrenergic drugs which are CNS stimulant. So those drugs which are used as a CNS stimulant. So amphetamine, dexamphetamine, methamphetamine, methylphenidate. So these drugs they are used to treat the narcolepsy. These drugs they are used to treat the narcolepsy. They are CNS stimulant. Amphetamine, dexamphetamine. तो यहाँ पे amphetamine अगर याद रखो आप, बाकी डेक्स्ट्रा एम्फेटामाइन उसका ही डेरिवेटिव है, मेटाम्फेटामाइन उसका ही डेरिवेटिव है, मिथाइलफेनिडेट भी उनका ही डेरिवेटिव. So CNS stimulant में amphetamines. Now next class is anorectics. Class number 6 is the anorectics. So what do you mean by anorectics? Anorectics means those drugs which are used to decrease the appetite and they are useful in the obesity. तो ये आपका भूख कम कर देंगे. ये आपका जो भूख लगता है, आपको भूख लगता है क्योंकि आप बहुत भूखड़ हो तो आपको बहुत ज्यादा भूख लगता है, तो आपका भूख कम करने के लिए ये ड्रग यूज करते हैं. कौन से? एनोरेक्टिक. Okay, anorectic means those drug which decreases the appetite. Okay, those drug which decreases the appetite, so known as anorectic. So in that you have amphetamine, fenfluramine, dex, fenfluramine and sibutramine. Sibutramine, dex, fenfluramine, then fenfluramine and amphetamine. They are known as anorectic. They are used in the treatment of obesity. Then next class, 7th class is nothing but the uterine relaxants. तो जो यूटरस होता है आपका लेडीज में, यूटरस का स्मूथ मसल रिलैक्सेंट कौन से ड्रग है? रिटोड्रिन, आइसोक्सुपिरिन, ritodrine, isoxapirin, salbutamol, terbutaline. So out of that salbutamol, terbutaline, they are also used as a AKI anti-asthmatic drug because you can see ritodrine, isoxapirin, salbutamol, terbutaline, they are known as a beta 2 agonist. Beta 2 agonist. So beta 2 receptor इसके ऊपर होता है uterine muscle के ऊपर, bronchial के ऊपर भी होता है. That's why this drug used as a uterine relaxant. Okay, these are adrenergic drugs or sympathomimetic drugs. You have to recall alpha receptor होता है. What are the receptor of noradrenaline? Alpha receptor, alpha 1, alpha 2. Beta receptor subtype beta 1, beta 2, beta 3. Beta 3 receptor होता है आपके adipose tissue में. What is the role over there? Lipolysis. You have to recall that. Okay. You can order this magic bullet for GPAT Niper DI Pharmacist exam preparation. Read 2-3 times before exam and qualify 100% with very good rank. We have very much promising result from past 5 years. You can also join our online GPAT Niper 2024-25 online classes. Live lectures, recorded lecture, study material and online test series. Everything is there in a.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100%